A nurse is a profession trained person, trained to care for the sick as well as the well. She's not just restricted to care for the sick. She's also expected to care for the well. The major responsibilities of a nurse, first of all, this nurse, she's an advocate. She speaks for those who can't speak for themselves. And the other major responsibilities, she's a communicator. She's the one who communicates between the patient, the doctor, and she's also a carer. She has to be empathetic. She has to put herself in the shoes of the mother. Here, I'll restrict myself to our babies. You know, a lot of times I've said the biggest patient is the mother. Look at a 2-day-old baby. Doesn't know anything. It's actually the mother who is more worried compared to a 2-day-old baby. So her responsibility is to ensure that she calms down the mother, she gives psychological care to the mother, and she assures the mother that we are doing everything possible in order to ensure that there is safety of the baby, and also to ensure that the baby is okay. When you have a good seed, you'll find even the patients, when one nurse who is good attends to them, they'll forget about the bad seed. So my appeal, especially to the younger ones who are coming in this profession, one thing they should know, it's not just a job, it's also a calling. When you say you want to become a nurse, you've convinced yourself that I want to be a nurse. These days, I joke with them, I tell them, you are lifesavers because you are here to save the lives. So my appeal, even to parents, as they're sending these children to become nurses, they should start by counseling them so that they know that the profession that they are taking is not just a profession to get money, it's actually a profession to save lives. It's a profession to help even those that are not sick. Some of them may just have a psychological problem and they need this nurse who's got empathy, who can listen to them, who can show them that love. That is the only care they need. We have hierarchy. At ward level, we have the senior nurses, and then we have the sister in charge, that is at ward level. Then we have departmental level, there's the nursing officer. Then we have the principal nursing officer, and we have the chief nursing officer. So that is the hierarchy. At ward level, there's the sister in charge. The sister in charge is actually the driver of the ward. She's the owner of the ward. She sets priorities in that ward. Most of the times, they abide on the hospital objective. Like one of our objectives for this hospital is to reduce the mortality in the neonates. So whatever the sister in charge plans to do in that ward, it has to buy into reducing the mortality of the neonates as well as the children. To the public out there, we are your partners. And like I've said, the nurses, they have their supervisor. If you are not happy with the service that has been provided to you, go to the next level. We want to create an environment that is conducive for our brothers and sisters, our children, our grandparents, because the hospital, it's a place not where you only find the sick people. Sometimes you even find the healthy people. They want to come and find out. They are not sick, but they just want to find out, what should I do? This is what is happening to me. And then you you give them advice. They shouldn't get scared to say, if I go there, they will shout at me. No. They are our partners, and we are there for them. The most important lessons I've learned is, one, patience, having an hearing ear to the patients, communication, and also to listen to the patients.